Good afternoon. My presentation will go over the pinworm, whipworm, and hookworm. Just as a refresher, the GI tract is the pathway in which the food that you put in your mouth goes through the esophagus, stomach, small intestine, large intestine before being excreted as waste from your body. The pinworm, whipworm, and hookworm are all parasitic to the digestive system. However, as we will discuss later in the presentation, the hookworm also utilizes the circulatory system as a means of living. The pinworm. Pinworms are generally very specific to their host. Humans are considered the only host for the E. vermeticularis, although occasional infections have been reported in captive chimpanzees. Other species infect goats, sheep, horses, rabbits, and others, but for the purpose of this presentation, we'll just focus on those that affect humans. Pinworms are thin, white roundworms. It is a parasite that lives in the colon and rectum of humans and receives its nutrients and foods from the foods eaten by the host. The adult pinworm is white in color and resembles a piece of thread. It has no buccal cavity. At the anterior extremity, a pair of cervical alae is seen. The posterior part of the esophagus is dilated into a globular bulb. The posterior third portion of the body is curved. The body contains an exposed copulatory spicule. 3 lips surround the mouth and the bulb on the posterior end of the esophagus. Each of the 2 uteri can lay 1,000 eggs in women. Only the females have uteri. Females measure from 8 to 13 millimeters long. The posterior portion of the female is extremely straight, tapering to a finely pointed tail. The females lay an average of 11,105 eggs per lifetime. Males are between 1 and 4 millimeters long. They have a posterior end strongly curved to a button hook and have a single spicule that's about 100 to 141 micrometers long. The adult pinworm is visible without a microscope. So towards the bottom of the page, you can actually see the pinworm there. It's measured towards the bottom. On the right-hand side, it's the female versus the male pinworm. Pinworm eggs contain the following characteristics. They are translucent and have a sticky surface. They measure between 20 and 30 macrometers. The shell is thick and flattened on one side. They're transmissible as an embryonated egg. About 1,000 eggs can effectively fit on the head of a pin. The photo to your left is magnified at about 40 times bright field, but depending on the size of your screen, and it probably appears a lot bigger than it is in real life. Okay, let's see how they get around in, I guess, the life cycle as well. Eggs are ingested via person-to-person transmission through handling of contaminated surfaces such as clothing, linen, curtains, and carpeting. It is important to note that infective eggs can survive up to 3 weeks on surface areas if the conditions are appropriate. Infection occurs via self-inoculation, which is basically transferring of the eggs to the mouth with the hands that have touched a contaminated surface or the colon area. Eggs can in fact become airborne and may be inhaled or swallowed. May be inhaled and swallowed, but this is not as common. Following the ingestion of infective eggs, the larvae hatch in the small intestine. The larvae contained inside the eggs develop and become ineffective in 4 to 6 hours under optimal conditions. The adult pinworms establish themselves in the mucosa of the cecum. The time from ingestion to ovipositioning By the adult females is about 1 month. The females migrate nocturnally through the colon outside the anus and deposit their eggs while crawling on the skin of the anal area. Newly hatched larvae may also migrate back into the anus, and this is known as retroinfection. So if you see in the picture here, yeah, it starts, you can actually self-contaminate yourself. The people most likely to be infected by pinworm are children under the age of 18, people who take the caregivers of infected children, and people who are institutionalized. In these groups, the prevalence is about 50%. Pinworms or their eggs can be carried among common surfaces such as hands, beds, toys, clothing, and toilet seats. By putting anyone's contaminated hands around the mouth area or putting one's mouth on common contaminated surfaces like toys in a daycare center, a person can ingest pinworm eggs and become infected with the pinworm parasite. Since pinworm eggs are so small, it is possible to ingest them while breathing. School and preschool age children, institutionalized individuals, are at the greatest risk of pinworm infestation and outbreaks, as I said previously. Pinworm infestations are common among caretakers. Children who suck their thumbs are at greater risk of getting pinworms because they are more likely to swallow the eggs. Children are usually the victim of enterobiasis, which means infected by the eggs. Familial infection is common among households. An infection may be symptomless. Pinworms is not a serious condition. However, it can cause severe itching of the anus, leading to difficulty sleeping at night. The itching is caused by female pinworm laying their eggs on the skin surrounding the anus. Itching around the area is common. Gastrointestinal symptoms such as pain, nausea, vomiting, diarrhea may develop. In female patients, vaginal irritation or vulvovaginitis may occur, and urethral infection in males. The picture at the lower right is actually an infant with worms, and if you actually look closely, you can actually see the pinworms. Diagnosis is made clinically by observing the female worms in the anal region. If you suspect that a loved one is infested, one can use a flashlight in a darkened room to view the anal region. This is best done at night because the females travel to the region to lay their eggs at night. This should be repeated several nights in a row if nothing is found on the first night. To assist your doctor in making a diagnosis, you can perform the tape test. As soon as a person you suspect has pinworm wakes up, before he or she uses the toilet, showers, or takes a bath, press the piece of adhesive transparent tape to the skin around the anus. The eggs will stick to the tape. For best results, perform the tape test 3 nights in a row and take the pieces to your doctor. The doctor can look under a microscope and see if there are any pinworm eggs. Anal swabs can be performed by a medical professional as well. But like I said, if they're most active at night, you may only find them at night. At the bottom is an example of how the tape is looked at in a medical facility. Pinworms can be treated with a number of different prescriptions, both over-the-counter, oral, as well as prescription. Medications do not always kill the pinworm eggs. so a second dose is required to prevent the reinfection of eggs as they hatch. Just one treatment is rarely effective. Repeated infections should be treated with the same medication as the first infection. In households where 2 or more people are infected, everyone in the household needs to be treated simultaneously. In large institutions, simultaneous treatment of the residential population should be repeated within 2 weeks. To prevent pinworm infections, wash your hands using soap and water, particularly after using the restroom, changing diapers, or before handling foods. Teach children the importance of washing their hands to prevent infections. To stop the spread and possible reinfection, people who are infected should shower every morning to help remove the large amount of eggs that may have accumulated around the rectum. Bathing can be potentially dangerous as it can contaminate the bath water with pinworm eggs and cause reinfection. Infected people should not co-bathe, use hot tubs or steam rooms with others during an active infection. Everyone should keep their fingernails cut short, avoid biting their nails or putting their fingers in their mouths, change underclothes and bed linens every morning. Per the CDC, they recommend that clothing and bed linen not be shaken as to spread the eggs. All items should be laundered in hot water followed by a hot dryer to kill any eggs. Whipworm. The whipworm that primarily affects people is the trichiura, also called the human whipworm. The genus has over 20 species which infect the large intestine of their host. It is a soil-transmitted parasitic helminth. Adults look like a whip. The anterior portion is very thread or hair-like, while the posterior is club-like. Both sexes have stichosome esophagus in the anterior end. The posterior end contains the intestine and sex organs. Female worms are longer than males, measuring about 4 to 5 centimeters in length. Their whip is either comma-shaped or arc-shaped. The female worm can lay anywhere between 2,000 and 10,000 eggs per day. Adult males are 3 to 4 centimeters in length and are recognized by their characteristic coiled posterior end. Eggs measure 50 to 54 in length and 22 to 23 in breadth. They are barrel-shaped with a mucus plug on each end. They're brown-colored from the bile with a double shell. The lower magnified image of an infected egg was incubated for 4 weeks at 26 degrees Celsius, obtaining a development in stage 2. Non-embryonated eggs are not infective to humans. Adult whipworms are found in the large intestine, usually in the ileocecal region. After mating, the eggs leave the body in the feces. Eggs must be embryonated before they are infective, which takes about 3 weeks. Infective eggs are ingested from fetal oral transmission. Upon ingestion, the larvae hatch and penetrate the small intestine to mature. They eventually migrate to the cecum of the large intestine and complete maturation in 3 months. Adults can live for years and deposit thousands of eggs per day. Once deposited into the soil, eggs can also mature in the soil after 15 to 30 days if conditions are normal, and then be consumed as worms. Again, reinfecting. There are 600 to 800 million people infected with whipworm globally. It's most common in areas where human feces is used as fertilizer or where people defecate in the soil. Worms are conveyed from person to person via fecal-oral transmission or by eating feces-contaminated foods. Globally, infection is common in tropical regions where access to personal hygiene and sanitation is not available. They're mostly in tropical areas in Asia and to a lesser degree in Africa and South America. Affection occurs most often in the southern regions of the U.S. when compared to other areas in the United States, and this may be due to weather conditions. Children are most frequently infected. Symptoms are highly dependent on the number of worms present in the body. People with a light infection may not experience many symptoms or any at all. Those with a greater infestation may encounter frequent painful bowel movements. Stool may contain a mixture of mucus, water, and blood, and even rectal prolapse is possible. In addition, heavy infection in children can contribute to severe anemia, impaired cognitive development, intellectual disability, and delayed growth. Eggs can be detected using a microscope stool examination. Diagnosis is based on visually seeing the lemon-shaped eggs in the sample or by observing the adult worms during a colonoscopy. The photos towards the bottom of the screen were actually taken of a 15-year-old female patient during a routine colonoscopy. She had no symptoms and had no idea she had worms. Anthelmintic medications are drugs that are used to rid the body of parasitic worms. Oral route medication is generally prescribed for 3 days. Occasionally, a stool exam is completed following the treatment to ensure effectiveness. Iron supplements may be prescribed for anemia. Drugs used to treat whipworm are safe and inexpensive and often donated to areas that need it. Entire risk groups are often given preventative treatment at one time. Mass drug administrations are conducted periodically and often given door to door. Multiple neglected tropical diseases such as whipworm and hookworm, river blindness, and lymphatic filariasis are treated at the same time using the same MDAs. How to prevent infection? Avoid contact with soil that may be contaminated with human feces, including fecal matter. The fecal matter used to fertilize crops. Wash your hands with soap and warm water before handling food. Teach children the importance of washing their hands to prevent infection. Wash, peel, or cook all raw vegetables and fruits before eating, particularly those that have been grown in soil that has been fertilized with human manure. Try to avoid defecating outdoors, and make sure wherever you travel that there's a effective sewage disposal system. Hookworm. Hookworms are intestinal blood-feeding roundworm parasites that cause infection in humans. Hookworm infections are caused by two main species belonging to the genera intestinal hookworm disease in humans are caused by the Acinetoloma and Nicator genus. There are others, one in particular that primarily affects canines. They are able to pierce the skin and enter the body, but they're not able to grow their larva under the skin, so we won't focus too much under that. These two listed here are the ones that we'll look into for this presentation. The two major genera that affect humans are the Nicator and the Acinetoloma, and they are characterized by the presence of either teeth or a cutting plate that lines the buccal capsule. The Nicator americanus is generally considered the only member of its genus group that affects humans. They have very different or very similar characteristics as noted in the chart. However, the mechanisms are quite similar and will be discussed collectively as a human hookworm in this presentation. Hookworm eggs gain nutrients from the feces of the host that it has inhabited. In the larval stage, hookworms are free living in the soil. They aren't there for long, but while they are, larva hookworms gain its nutrients by observing it from the surrounding areas. Once juvenile hookworms have found a host, they feed on anything. They feed by attaching themselves to the blood vessels and consuming the blood. The adult hookworm feeds on its intestinal tract of its host. It attaches to the intestinal wall with its buccal teeth. These teeth are also used to tear open the blood vessels in the intestine to consume blood. They're grayish white or pinkish in color. Their interior ends bend dorsally, which gives them the name hookworm. The oral opening is directed towards the dorsal surfaces. In both species, males are shorter, whereas the females are often longer and stouter. And we just went over that in the previous slide, basically going over where they get their nutrients. The life cycle. Per the CDC.gov, eggs are passed in the stool with the appropriate moisture, warmth, shade. The larva is able to hatch within 1 or 2 days and become free living in the world, in the contaminated soil. These released larvae grow in the feces and or soil, and after 5 to 10 days, they molt and become flariform, which is the third stage, and infective at this stage. The infective larvae can survive for 3 to 4 weeks in favorable environmental conditions. Once they become in contact with a human host, which is usually the bare foot of a human host, the larvae penetrate the skin and it's carried through the blood vessels to the heart and then the lungs. Once at the lungs, they penetrate the pulmonary alveoli, they ascend down the bronchial tree to the pharynx, and then they are swallowed. This leads them to the trail. The larvae then reach the duodenum in the small intestines, where they reside and mature into adults. Adult worms live in the lumen of the small intestine, where they attach to the intestinal wall, resulting in blood loss of the host. Most adult worms are eliminated in 1 to 2 years, but can remain in the intestine for much longer. Some larvae, following the penetration to the host skin, can become dormant in the intestine or the muscle and reactivate as needed, or they can cause infection. Unlike the worms discussed previously, the hookworm actually develops into larvae outside the host prior to maturity. So if you follow here, the host steps on the larvae into the skin. The larvae then use the circulatory system to travel into the lungs. Once they reach the lungs, they go into the larynx and they are actually swallowed. So they're eaten without us even knowing. And then they travel to the small intestine. Yeah. Before traveling to the large intestines, laying eggs and excreting those eggs, or defecating rather. Between 5 million and almost 800 million people in the world are infected with hookworms. People in areas that are warm and moist climates and where sanitation and hygiene isn't the best provide the greatest risk of infection or contamination. When soil is contaminated by an infected person defecating outside, that's when things happen. Maintaining appropriate hygiene practices and people with hookworm are typically asymptomatic, especially if the infection is minimal. People may experience a bit of itching or discomfort at the site of penetration, but when one or more adult worms attach to the intestinal wall, a person may experience abdominal pain, anorexia, iron deficiency if the anemia is caused by blood loss in the intestine from the intestinal attachment. And in the severe cases, a person may experience protein malnutrition from chronic plasma protein loss. Worm secretions actually prevent the blood from clotting. As noted previously, some larvae following penetration into its host skin may become dormant in the muscle or intestines where they can reactivate or cause infection. So looking at that picture in the center, that's definitely some infection going on there. The worm is actually large, so I'm not even sure that's larva anymore. If you look at the picture to your right, you see the smaller infection there, but you can see how it's traveling up through the system. Yeah. Just as with the previous worms, it's treated with the same medications. It's also given as MDA, so in countries or in areas where there's mass infection, there's mass treatment, hopefully at the same time. Yeah, same rules apply there, so we don't need to go over that again. Hookworm prevention. Avoid walking in places where the soil or sand may be infected. Don't touch the ground with your bare hands. If you have to sit, try to sit on a tarp or a barrier instead of sitting on the bare earth. Take precautions when visiting locations where people defecate outdoors or human feces are used as fertilizer. And that's all. Yeah, if you have any questions, just let me know. Thank you.